Guys, Dr. Hampton here with Dr. Bret Scher, author of a wonderful book entitled Your Best Health Ever, and of course, the medical director of The Diet Doctor, which is the number one low carb website in the world. You know, guys, there are so many ways to determine whether you're metabolically healthy. And now we have a new kid on the block, and that new kid is called lipoprotein A particle. Today, I've asked a world renowned cardiologist to share his thoughts on who and when you should be considering this new test. So, Dr. Sher, tell me a little bit about this marker and who should be thinking about using it.
Yeah, thanks, Tony. It's a great point to talk more about lipoprotein little a or LP little a. And basically what it is, it's an LDL particle, but it's modified in a way that it's got this extra protein on it called a kringle. And it modifies it enough that it's not cleared as well from the circulation by LDL receptors. And because of that, it sticks around much longer in circulation. It's also more prone to be oxidized, and it's more prone to get retained into the vessel wall. So we know with LDL particles, they're not all the same. The ones that are oxidized are more concerning than the ones that are not, and the ones that are more likely to be retained in the vessel wall are more concerning than the ones that are not. Well, LP little a sort of has the worst of both worlds. It's more likely to get retained in the wall and more likely to be oxidized. But it also mimics a protein in our body that stimulates what we call the coagulation cascade, meaning makes your body more likely to form clots. And because of its structure, it actually sort of mimics this protein a little bit. So it, on top of its lipid potential, it also adds some blood clotting potential. So all these things combined make it a concerning cardiovascular risk marker. And the studies show that it's as high of a risk, if not more high of a risk than LDL itself. Now, one of the problems is, when you turn to the question of, well, what can you do about it? And right now, the answer, unfortunately, is not much. There isn't a whole lot you can do from a lifestyle standpoint. Interestingly, a low carb, high fat diet has the best evidence of lowering LP little a from a lifestyle perspective, although it's a lot of sort of, case reports and anecdotes, not big studies. But even then, the lowering is sort of small in magnitude, but it is the best approach for doing so from a diet standpoint. But it's something that I think most people should know, and I recommend everybody get it checked at least once. It's one of those tests where you may not have to follow it much over time unless you're specifically doing something to try and target it. But it's good to know once because it can change how you see your cardiovascular risk overall. Maybe your LDL is not much of a concern, but you've got a calcium score that's elevated and you're trying to wonder why, because your blood sugar is good and your insulin's good and your blood pressure is good. And you're like, how could I have a high calcium score? Well, if you have high LP little a, maybe that explains it. And depending on what your LP little a is, that may inform how aggressive you get about treating some of your other cardiovascular risk factors. Now, there are some drugs being studied right now that may come out in the next few years. And I think that's part of the reason why LP little a has gotten so much attention recently, because of these drug studies. But I think it's a good thing regardless that we're putting more attention on it. And things like vitamin C and niacin and L-carnitine and proline and lysine, you can find lots of different ways that can affect your LP little a little bit. But to have big dramatic effects, I think it serves more as a marker for more motivation to make sure your lifestyle is on point, that your other cardiovascular risk factors are on point, that you're really taking a look at the whole picture. And this is one important piece of the puzzle.
Yeah, I love the fact that lifestyle will impact it. So I wouldn't wait for the drug to come out, guys. I would go ahead and start focusing on your lifestyle. And if we do lifestyle, then maybe we won't need a drug one day in the future. So, and now I understand why it hasn't been in the news, because it hasn't had a lot of, movement in that direction, because we didn't have a medical way to treat it. So, but the best way to treat health conditions is with lifestyle. So thank you, Dr. Bret Scher, for your insights. I just really wanted to get a cardiologist to speak to that. And I just wanted my viewers to have another tool in their toolkit as they work to achieve metabolic health. So guys, if this intrigues you, consider discussing this with your clinician to see if it may add value My goal is to simply create awareness so that you are empowered to have the information that will serve you. So again, thank you, Dr. Bret Scher. And for those who are watching, be safe, be well, and continue to protect your nest.